All right, this is just a quick recording about why plateau pressures as measured by OR ventilators can be misleading in COVID. And it has to do with resistance that builds up over the HME filters. So here's your patient and your ventilator. You've got a pressure that's measured at machine, and this is the only pressure that's actually reported by the ventilator ever. And you've got a pressure in the lung, and this is the one that you care about more. And of course, there's resistance to flow all the way along, and the difference between the pressures and the resistance, that's what establishes the flow. So what is the plateau supposed to measure in the first place? Well, this is your typical volume control ventilation. In volume control, you set a flow during inspiration, and actually during expiration, it just sets a peak. And everything else that is recorded is the interaction between the machine and the patient. So let's add a volume loop to this so we can better understand what's going on and ask what happens to volume during inspiration. Well, volume in the lung, because we have a constant flow, will increase linearly. So what happens to pressure in the lung? And remember, we don't measure this, so I'm just asking what happens to the pressure in the lung. Well, if we simplify things and say that compliance of the lung is relatively stable during inspiration, well, we've got a constantly increasing volume in the lung with a non-changing compliance. The pressure in the lung is also going to linearly increase. So this assumes that it starts at PEEP and just linearly increases. Great. So what happens to the pressure at the machine? Well, remember, the pressure at the machine has to be higher than the pressure in the lung during inspiration because you're driving flow in, and that flow is actually constant. So if resistance doesn't change over the inspiratory cycle and the flow is constant, then the pressure at the machine has to be a set amount higher than the pressure in the lung, and that amount higher should stay the same. So initially you want to establish that flow goes up, and then it stays that amount higher than the pressure in the lung. I'm adding expiration here and not going to describe it because it's not as important to what we need to know regarding this talk. So what's the highest pressure generated by the machine? Well, it's right there. We call that peak pressure. What's the highest pressure seen by the lung? Well, it's right here. That's the highest pressure. Now we call that plateau pressure, and we call it plateau pressure because of how we measure it. But we don't actually measure it here. We're blind to it. We can only measure the pressure at the machine. And we can't know the plateau pressure when there is flow, right? Because if there's flow, then there must be a pressure differential between the machine and the lung. Remember, flow is equal to your pressure differential divided by resistance. So if we wanted to know the pressure in the lung, we have to bring flow to zero. Because if flow is zero, then there's no pressure differential. So we set flow to zero, and then we look at whatever pressure is measured there. So that's what we do. We set flow to zero, the volume in the lung stays the same, and the pressure at the machine equals the pressure in the lung. That's our plateau pressure. We call it plateau pressure because we wait for it to plateau, and whatever pressure is read there, that's the pressure that the lung is seeing. So what's the problem? Well, the problem is right there. It's because this is represented as a square wave. I'll blow this up so you can see it here. There's the plateau, there's the peak, and we're assuming it just goes down and then over. But that's not the case, right? Because there's resistance to flow, and there's going to be a little bit of higher pressure in the airways and such that has to come out, and that doesn't happen instantaneously. Remember, this inspiratory pause, if you have 20 breaths per minute with an I/E ratio of 1 to 2, you only get 1 second for inspiration, and if you set your inspiratory pause to 10% or 20%, that's only 100 or 200 milliseconds. It's not a lot of time. Under normal circumstances, it's fine. You've got minimal resistance to expiratory flow, and that reaches this plateau relatively quickly. Take a look at this balloon. I'm using a large straw to simulate not a lot of resistance to flow. And you see this happens pretty quickly. It's not immediate though, it's not instantaneous, so it probably looks more like this. What happens though if resistance to expiratory flow builds up, as happens as the HEPA filters get clogged with secretions and condensation? So I'm going to simulate that with a smaller straw. A smaller straw will have greater resistance to flow the same way that a clogged filter will have greater resistance to flow. And what you see is that it takes a lot longer for that balloon to deflate. And that's going to be the case. As you increase resistance to expiratory flow, this curve is going to move to the right. Something like this, or this, or this. But the machine is not smart. The machine does not look to say, have I really reached a plateau? If you're looking at it, you can kind of tell, is it down there and then flat for a little while? But if you're not looking at it, what's reported is this. That's what's reported by the plateau, and you think, oh no, it's a compliance issue because the plateau pressures are higher. But you've been deceived. It's actually a resistance issue here. This is made even worse if our inspiratory times are shorter. Any one of these is going to be reported as even higher. This would happen if you do lower inspiratory pause to inspiratory time ratios, or if you have a faster respiratory rate, as we're seeing with a lot of the COVID patients. So what's the solution? If you want to see the actual plateau, set a high inspiratory pause. Set it to 40% and look at the waveform to make sure it's actually reached a plateau. You can do that with your eyes. The machine won't do that for you. If you need to, you could also decrease the respiratory rate, which would give you a longer inspiratory time, and then you could see what the actual plateau is as well. But I think it's probably fine just to do a high inspiratory pause time and look to make sure it's reached plateau. Otherwise, set the inspiratory pause to 0%. Anything above that is just going to make you at risk for being misled about a compliance issue when it's really a resistance issue. So how can you be cued into this? Well, look at the peak pressures. If the peak pressures increase, it's either a resistance to flow issue or a compliance issue. So if they increase substantially over time, check the plateau with a high inspiratory pause. If the plateau has increased, then it's probably a compliance issue. If the plateau pressure has not increased, then it's probably a resistance to flow issue. And you should really consider changing out the circuit, because the pretest probability that it's clogged up with condensation is a lot higher than it would be typically in the OR. Now, it could be something else. It could be a kinked tube, it could be secretions, so you have to keep those things in mind. But that's why the plateau pressure, as we are measuring it on our standard ventilators, especially with short inspiratory pause times, is misleading with these COVID patients in the ICU.